Hello, my name is Richard Michael Calzada. I'm a licensed professional counselor and a lead therapist with Connections Wellness Group. Thank you for joining me in this mental health connection. Today, I'd like to talk more about the concept of trauma and recovery. All of us have at some point in our lives experienced a really difficult experience or event. The event and our takeaway from it can be very overwhelming, and it can continue to stay with us long after the situation has passed. Trauma work in counseling has a lot of different approaches, one of which is eye movement desensitization and reprocessing, or EMDR. Trauma work and EMDR were first really looked at in the 80s. The idea of EMDR is to help an individual who continues to suffer from symptoms like anxiety, panic attacks, physical tension, poor relationships, nightmares, and other concerns in a way that is empowering for them. With our nervous systems, there is a very specific approach within EMDR that allows the person experiencing the trauma to ground themselves and bring themselves back to the present moment. Today, I'll be teaching you 2 quick grounding exercises that you yourself can use, even if you never decide to see a counselor or a professional for help. Let's talk about the first, which is the butterfly hug. The butterfly hug is very specific in that it allows you to engage your own sense of touch, which, as research has shown, is very effective in grounding somebody who may be trailing off, or losing track of where they are, things like that. When you do this on your own, you begin by tapping, alternating, finding the rhythm that works best for you. The idea is just to notice the feeling of the taps. When you use butterfly hug, it's a way to really help your nervous system come down from a heightened state of arousal. That heightened state of arousal happens whenever we feel in danger or when we're really worried about something coming up, like a test or a job interview. For those who continue to experience intrusive symptoms, the calm, safe place technique can take it one step further. I'll go ahead and show how that can be done on your own time. First, think of a place that you've been to. It can be anywhere where you felt very happy, carefree, and safe. And as you think about this place, or if you'd like, you're welcome to just create your own. A blueprint, if you will, like an image of being on the beach or in the mountains. When you're ready, you can do this eyes open or closed. Bring your place to mind. You're engaging your different senses, and you may start with your visual sense. Noticing things that you see there in that place. For example, colors, shapes, the weather, and if there are other people around, or if you're by yourself. Then you move on to another sense, like your sense of physical touch. As you look back, you might become aware of the different things you were feeling, like the breeze on your skin, or the heat from the sun overhead. Really soak in those details. When you feel ready, you can move on to your sense of smell. And ask yourself, what am I smelling here in this place? Finally, tune into different sounds you might hear. Could be the birds chirping, the sound of a river rushing nearby, anything like that. Once you've tuned into all these different senses, notice how it feels within you, any pleasant sensations. Once you're ready, you can pull yourself out by slowly opening your eyes if you had them closed, or just looking around the room or wherever you are to reorient yourself to this present moment. And that's Calm, Safe Place. I'm Richard Michael, licensed professional counselor and lead therapist at Connections Wellness Group, and I appreciate you taking the time to join me for this mental health connection. Thank you.